Good afternoon, everyone. I'm Daniela Gibbs-Leger, the Executive Vice President for Communications and Strategy here at the Center for American Progress, and welcome to today's event. Before we get started, let me do a quick piece of housekeeping to say that live captioning is available by clicking on the closed caption button at the bottom of your screen. Now, I'm delighted to introduce Jen Klein, the Director of the White House Gender Policy Council, who will join us in just a moment. After that, I'll bring in our fantastic panel, but first let me say a few words. The extra cost of being a woman is clear across the board. Women have tended to pay more for mortgages, more for car insurance. In fact, women aged between 19 and 34 pay, on average, more than double what men pay on annual health spending. And these extra costs can be found in unexpected places. Women's shampoo is more expensive, women's deodorant, women's razors, haircuts, medical braces, getting a shirt dry cleaned. For girls, toys are more expensive, bicycles, backpacks, the list goes on and on. And none of that, of course, includes the fact that 27 states currently classify menstrual products as luxury items, which levies even more costs on those products because of the taxes associated with them. And then there's the wage gap. One study found that over the course of a 40-year career, the wage gap costs full-time working women over $400,000. For Black women, it's close to $1 million. For Hispanic women, it's well over that. It's a reminder of the stark biases and discrimination that's rooted in our economy, and unfortunately, there's no quick fix or single answer. The solution requires a multi-pronged approach that addresses healthcare, childcare, paid family and medical leave, education, the federal minimum wage, and more. The extra costs associated with being a woman don't exist in a silo, and nor do the policy solutions that are necessary to change it. This Women's History Month, we have been reminded of the integral role that women play in this country, whether that's through the grace and dignity with which Judge Brown Jackson has handled her Supreme Court nomination hearings, or in reflecting on the colossal impact that Secretary Albright, the first female Secretary of State and former member of CAP's board and a giant in the world of diplomacy, has had on our standing as a nation around the world. Women shape this country, they lift it up, and they shouldn't have to pay more to be a part of it. And so I'm thrilled that we're hosting this event and thrilled to welcome Jen Klein to share her thoughts. As director of the White House's Gender Policy Council, Jen has played a key role in shaping gender equity and equality within the executive office of the president. Previously, she served as deputy and senior advisor on global women's issues for Secretary of State Hillary Clinton, and also served as a senior domestic policy advisor to Hillary Clinton in her capacity as then First Lady. Jen, thank you so much for joining us, and the floor is yours.
Thank you so much, Daniela. And thank you to the Center for American Progress Women's Initiative for inviting me here today for this important conversation. You've already covered so many of the issues which really add up to, as you so well said already, to a real issue of the additional costs of being a woman. When President Biden and Vice President Harris took office, we faced a divided country, a global pandemic, and an economy under severe stress. The administration really has moved quickly to deliver results for working families and have kept women and families at the center of our agenda. In the first year alone, President Biden added 6.4 million jobs, the most ever in 1 year, and has managed the fastest growing economy in decades, turning the tide on women's labor force participation, which, as we all know, had hit a 35-year low. On International Women's Day last March, President Biden signed an executive order formally establishing the first ever White House Gender Policy Council, charged with leading a government-wide approach to advance gender equity and equality, and with developing the first ever national gender strategy. And as you heard from Daniela, that commitment and the existence of this council and this strategy really has allowed us to put a laser focus on this series of economic issues affecting women and girls across the country and really around the world. The Gender Policy Council, or GPC as we call ourselves, works on a range of issues impacting the economic security, health, and well-being of women and girls, with policy priorities that cross both domestic and foreign policy. As part of our work to strengthen women's economic security, we are focused on making progress toward equal pay. And I'll really focus my remarks today on the various facets that add up to the pay gap and the various things that we can all do to address that gender wage gap. Equal pay is a matter of justice, fairness, and dignity, and it's essential to building an equitable economy and addressing the barriers that have long hampered women from fully participating in the labor force. Since the COVID-19 pandemic began, we have seen women, particularly women of color, disproportionately working on the front lines, caring for our loved ones and working to combat the virus, but they continue to earn less than their male counterparts. In 2020, the average woman working full-time year-round for wages or a salary earned 83 cents for every dollar paid to her average male counterpart. Of course, as we all know, these disparities are even greater for Black and Native American women, Latinas, and certain subpopulations of Asian women, with some Asian women, such as Cambodian and Vietnamese women, earning among the lowest wages. We all know these numbers well. Many of us have tracked the incremental changes over the years, but it's worth taking a step back to assess the impact that pennies can have. Over the course of a career, those cents add up to hundreds of thousands of dollars in lost earnings, particularly for women of color. Lower wages mean working women have less money to pay the bills, less money to put away, and uniquely burden households led by single mothers. Lower wages can also mean that women receive lower Social Security benefits down the line, contributing to disproportionately high rates of older women living in poverty. For so many women, this gender wage gap acts as a virtual tax, making it so much more difficult to invest in their future. That's why this past Equal Pay Day, just a few weeks ago, the White House announced critical steps that the administration is taking to advance pay equity, beginning by using the tools we have to encourage transparency and to reduce pay discrimination. I'll just take a couple of examples of what we talked about on Equal Pay Day and the policy announcements that we made. The Office of Personnel Management announced that they would begin to address the use of salary history in the hiring and pay setting process for federal employees. And the president signed an executive order directing the Federal Acquisition Regulatory Council to consider limiting the use of salary history in employment decisions by federal contractors. The Department of Labor also directed federal contractors to strengthen pay audits, which help organizations determine whether or not they're paying their employees equitably, and if they're not, gives them the data they need to correct that inequity. The president also, in the past, had issued executive orders directing the administration to work toward ensuring that federal employees and employees working on federal contracts earn a $15 per hour minimum wage. Those directives went into effect in January, raising the wages of about 370,000 workers. In addition to helping the government do its work more efficiently, these directives take a step toward narrowing racial and gender pay disparities in income, as many low-wage workers are women and people of color. Importantly, these actions address a range of variables that contribute to equal pay. The pay gap doesn't only reflect outright pay discrimination. It also results from the barriers that women face in accessing good-paying jobs and meeting caregiving responsibilities, including a lack of affordable childcare, paid family and medical leave, and fair and predictable scheduling, which often prevent women from joining and staying in the workforce. Women are also routinely shut out of good jobs in high-paying industries such as science and technology and transportation. On Equal Pay Day this year, the Department of Labor issued a report analyzing the impact that women's concentration in low-wage sectors and their relative underrepresentation in many good-paying occupations has had on their overall economic security and on gender and racial pay gaps. The report finds that in 2019, Black women lost $39.3 billion and Hispanic women lost $46.7 billion in wages compared to white men due to the differences in industry and occupation. This occupational segregation intensified the pandemic's disproportionate impact on women, in part due to the overrepresentation in women in hard-hit industries such as hospitality. With the signing of the bipartisan infrastructure law, we have a tremendous opportunity to transform the landscape of inequality in America, including through tackling this issue, occupational segregation. Administration investments through this law will increase access to good paying jobs, including for women, people of color, and members of other communities who are currently underrepresented in the sectors where these jobs will be created, such as transportation, clean energy, and broadband. To that end, the Department of Transportation and the Department of Labor recently signed a memorandum of understanding to promote the creation of good infrastructure and transportation jobs, with a focus on equitable workforce development using funding from the bipartisan infrastructure law. And in the president's fiscal year 23 budget, just announced yesterday, he proposed doubling the Department of Labor's investment in its Women in Apprenticeship and Non-Traditional Occupations grants, which provide pre-apprenticeship opportunities to boost women's participation in registered apprenticeships, a proven earn and learn model that raises participants' wages and puts them on a reliable path to the middle class. We are also focused on improving the quality of jobs in which women are overrepresented in the workforce. Historically, women have typically held jobs with lower wages and fewer benefits and protections. Women of color are even more likely to work in these jobs. A prime example of this phenomenon is care workers in childcare, elder care, and home health care sectors. Although professional care is costly for families, caregivers themselves, disproportionately women of color, remain some of the most underpaid workers in the country, often having to rely on public income supports to help them get by. On average, childcare workers make 23% below workers who do not work in childcare. Increasing compensation for childcare workers helps narrow gender and racial pay gaps, as more than 9 in 10 are women and more than 4 in 10 are women of color. The American Rescue Plan made significant investments in childcare, helping to keep childcare providers open and boosting pay for childcare workers. States have already delivered American Rescue Plan stabilization grants to more than 150,000 childcare providers, serving more than 5 million children and their families. Many states also use these funds to help boost compensation of the childcare workforce. For example, Minnesota is requiring providers to increase compensation, while North Carolina and Connecticut offered bonus payments to providers who increased workforce compensation. Disproportionate caregiving responsibilities also deepen the racial and gender wealth gap for informal caregivers and care workers. As study after study has shown, women are expected to shoulder an unequal share of unpaid caregiving responsibilities. When families can't afford or can't find caregiving, it often falls on women to fill the gaps, forcing parents and especially mothers to forego higher paying jobs, work fewer hours, or take time off out of the workforce, leading to lower pay over the course of their career. Over the past 2 years, the pandemic has only deepened these inequities as caregiving has become more expensive and, of course, more difficult to find. That's why the American Rescue Plan again focused on reopening schools, as well as other vital support for women and families, including the historic vaccination program, to direct payments to individuals, and to the child tax credit, which lowered child poverty by 40%. And the president continues to urge Congress to pass his plan for childcare, which could lower childcare costs for 9 in 10 families with young children. Just this week, in his remarks announcing his fiscal year 23 budget, he made the case for building a better America, outlining the investments needed to reduce costs for families, including by reducing costs of childcare and healthcare. This will build on the work that we're already doing through the American Rescue Plan, which provided tax relief to help families with childcare costs during the pandemic by delivering an historic increase in the child and dependent care tax credit to support millions of working families this tax season. This tax credit will reimburse most families for up to half of their childcare expenses, and it's fully refundable, helping lower income parents fully benefit regardless of their tax liability. I'm proud of that progress. We're proud of that progress. But of course, there is more we need to do. If we're going to continue to grow the economy and to be competitive and to lead the world in the 21st century, we can't afford to leave half the workforce behind. So I just want to end by thanking you all for your ongoing efforts. I know I am talking to a group who have dedicated themselves and their work to actually addressing all the issues that you're discussing today. We're grateful to your partnership, to your leadership, and really, I personally look forward to continuing to work with all of you in the months and years to come. Thanks.
Jen, thank you so much for sharing those thoughts and for really underlining the breadth of costs that women face in this country. And thank you for all of the work that you are doing. I know I speak for CAP when I say that we are energized and invigorated by the fact that the administration is taking such a focus on gender equity, that it's centering it in every aspect of its policy, and that we're making progress in reconciling the wage gap, the cost gap between men and women. So thank you for your work and thank you for your time. Now, let me turn to our panelists. And before we start, let me do some quick introductions. Munira Gunja is the senior researcher in the Commonwealth Fund's International Program in Health Policy and Practice Innovations. She joined the fund in 2015 and previously worked with the U.S. Department of Health and Human Services on healthcare access and coverage. Kate Ryan is the Vice President of Policy and Strategic Initiatives at the Institute for Women's Policy Research. She guides the Institute's advocacy and policy agenda and leads strategic initiatives and partnerships. Previously, she was the Senior Director of Government Relations at NARAL Pro-Choice America, and also led the Medical Drug and Device Safety Program at the National Women's Health Network. Betsy Stevenson is a professor of public policy and economics at the University of Michigan. She also serves in a number of other academic roles and previously served as a member of the Council of Economic Advisors from 2013 to 2015, where she advised President Obama on social policy, the labor market, and trade issues. Prior to that, she served as chief economist at the U.S. Department of Labor. And Cheryl Wade is the Dean Harold F. McNeese Professor of Law at St. John's University. She teaches on a number of topics at the intersection of race, gender, business, and governments, and for several years, served on the board of directors of the Women's Action Alliance. Thank you all for joining us today. Let's go ahead and dive right in. Betsy, I'd like to start with you. While we've made remarkable progress since the start of the pandemic in getting women back to work, significant gaps persist. And we know even before the pandemic that the economy wasn't working for women. Can you tell us a little bit about women's current employment landscape? What trends in women's employment overall are you keeping an eye on?
Thank you so much for that introduction and for having me on the panel today. I love the lead in that you gave because I think that there's a couple of different ways to think about this. First of all, the pandemic had an unprecedented effect on the labor market. It was the first recession or downturn that we've ever experienced that really hit at the heart of our labor market, which is the service sector. And women are the majority of employees in the service sector. And let me be clear that the service sector is not, a lot of people think it's the people who are on the front lines of serving, but it's also our doctors and our lawyers and our nurses and our computer scientists. So high wage service sector workers went home and worked from home. And it was lower wage service sector workers who were faced with a really difficult choice. And sometimes they didn't even have the choice, which is go to work in a job that became substantially more dangerous than anybody had signed up for, or stay home and not work. And all of the parents, regardless of whether you were working from home or not able to work from home, were dealing with the fact that we were now on our own to educate and care for our children. And I think that, really caused a lot of trauma for the children and for parents. And if we look at where we're at today, not all the jobs are back. And I think it's really important to realize people that talk a lot about a tight labor market, not all the jobs are back, not all the people are back. And it's disproportionately women who are not back. They lost most of the jobs. So, it's not, I guess that's a little bit to be expected, but it's looking a little bit like women are not playing the normal role they do in a recovery, which is to come back faster than men. They're actually coming back a little bit slower than men at this point. And so we put all that together and we say, okay, the labor market's recovering, but it's starting to leave some people behind. Who's getting left behind and why? And so a couple of things that I want to highlight. One is that we know the labor market was not working for parents. And that's not just women. I want to say parents, mothers and fathers. Mothers were struggling to balance childcare responsibilities along with their work in a way that was just unsustainable. And a lot of fathers really wish they had more time for their children. And I think that's one of the things we saw in the data is that prior to the pandemic, fathers were unhappy. And in the pandemic, they actually enjoyed the extra time they got with their kids. Yet now you put this together with a labor market where people are consuming different things than they consumed prior to the pandemic, where some jobs are more dangerous than they used to be, where people are treated differently than they used to be treated in some jobs. And we just have a lot of turbulence right now as workers try to look for jobs that are better fits for them. And there's just bigger demand in some sectors than others. But all of this has exposed the fact that workers benefit from flexibility. We knew this prior to the pandemic. Now the employers get to see it too. We actually saw productivity go up during the pandemic, something we've been telling employers since long before the pandemic, that giving people flexibility, they use some of that flexibility, not just to improve their lives, but to improve their work. So we learned that lesson, and I hope that sticks. We also learned that childcare and children's education are two sides of the same coin. And we need a full societal government policy approach to making sure that all our kids are equally invested in and all our families are equally supported. And that doesn't just start at age 5 in kindergarten. So these are some of the important lessons that we've learned. And I think there's one other thing I want to flag that I feel is not on a lot of people's radar, which is that it's those lower wage workers also lost more access to training during the pandemic. We saw big declines in enrollment in vocational programs and community college. Those programs, they're not just about a step up for individuals, although they're a very important step up for individuals. But I think we're going to be dealing with some labor shortages in areas where we rely on people to go to those training programs and get the skills that the economy needs. And with that declining enrollment, that's the kind of thing that's kind of a slow boil. It's going to take us a little while to realize that those skills are missing from our economy, and it's going to be disruptive as we realize it. And so we really do need to see more investment in making sure people can afford, both in terms of childcare, in terms of tuition, to get access to the kinds of vocational and training programs that are going to give them the skills they need to land a good job and to meet the demands of consumers in today's economy.
Thank you, Betsy. I want to talk about costs. Munira, we know women, particularly women of color, are often disproportionately burdened by healthcare costs, both for themselves and their families. Can you tell us a little bit about the trends that we see right now, and in what settings do women face the highest increased costs?
Yeah, thank you. I'm really excited to be here today. I think it all starts from the fact that roughly 10 million women in this country are still uninsured. And we know people of color are disproportionately uninsured. And from lots of survey work, we also know affordability is cited as most frequently as the reason why eligible uninsured people don't sign up for coverage. But even among women who are fully insured, about a quarter of them are still considered underinsured. So that means they have health insurance, but their out-of-pocket costs and deductibles are so high that their coverage really isn't even affordable based on their income. So this means that women who are either uninsured or underinsured are at increased risk of suffering from medical bill problems. And ultimately what this means is that if you're scared to use health services because you're going to face high out-of-pocket cost after, you may skip or delay needed care. Actually, next week we will be releasing a new brief that looks at the health and healthcare of women of reproductive age in the US compared to women in 10 other high-income countries. And we find that women of reproductive age in the US have among the highest rates of out-of-pocket cost. And just about half of them reported what we call having a cost-related access problem. So they're scared, so they skip or delay needed care due to cost. And while the Affordable Care Act took really big steps to ensure certain populations would be covered through health insurance, the reality is, until we can get all women not only insured, but truly provide them with affordable health insurance coverage that is comprehensive and fully covers benefits, that are specifically for women, including maternal care, millions of women will continue to face high out-of-pocket costs for themselves and their families.
And to follow up on that, last year, one study showed that 1 in 4 women have reported having trouble paying a medical bill, many due to COVID. And you've written about how the job losses experienced during the pandemic led to health coverage insecurity. So is there a worry that despite the state of our recovery, those impacts may reverberate in the long term, not only continuing to burden women's finances, but also their willingness and ability to seek needed care in the future?
Yeah, the US has had a history of hitting people with medical bills. This started before the pandemic, and without major reform, will likely continue. In the brief that we're releasing next week, we actually find that over half of women in the US of reproductive age suffer from medical bill problems. So that means they either have serious problems paying or are unable to pay a medical bill. They spend a lot of time on paperwork or disputes related to medical bills, or they were denied insurance payments from their insurer or paid less than they were expecting to get. This is the highest rate among women of any of the countries included in our analysis. In contrast, only 10% of women in the UK, where health services are free under the National Health Service, suffered from medical bill problems. But when we think about the long-term effects, and if we use the pandemic as our baseline, we know that women of color have been disproportionately affected by COVID-19. So if more women are having to leave their jobs and are no longer eligible for employer insurance, and they don't qualify for subsidized care through the marketplaces or Medicaid based on their based on where they live or their income, they may not have access to affordable health insurance options. So that means more women now may not go to the doctor for the preventative treatment and screenings, which ultimately may lead to what could have been avoided chronic conditions. And by the way, the US has the highest rate of avoidable mortality compared to other high-income countries. So these chronic conditions may lead to even bigger medical bill problems later on in life. So that's all to say, if you don't have health insurance right now and you don't go to your doctor for your preventative care, you may end up with high medical bills down the road for chronic conditions that could have been prevented with the right care right from the start.
Thank you. I just want to remind our audience that they can submit a question to the panelists by using the Q&A tab that's at the bottom of your screen. Cheryl, in your recent book, you talk about the impact of predatory lending and what it's had on the Black community in particular. I'm sure many of us have stories that we can tell about this practice. We know predatory lenders often target women. Can you speak a little more to these practices and their impact on women and their families?
Absolutely. Thank you, Daniela, for the question. And I'd like to thank CAP also for the important work you do. My book is about, as you mentioned, the African American or Black American community. And so I can speak to the way Black women were targeted in a way that I cannot speak to the way other women of color or white women were targeted. And all women were targeted in a way that did not equal the targeting of men for predatory predatory mortgages. Lenders had some very interesting strategies that targeted Black women in particular, and some of them were direct. So I'll just describe one. The lenders enlisted unsuspecting Black ministers of all Black churches to convince their congregation to do business with the predator. So the ministers were touting the benefits of home ownership. And not only are all of the congregants women, all of the congregants are Black, but most of the congregants are women. Now, the ministers doing this work for the predatory lenders didn't know that they were predatory lenders. They had no idea about the kind of predation that lenders engage in. The ministers were completely unaware that lenders use intentionally misleading terms in the mortgage documents and that they imposed hidden fees in the mortgage documents. The ministers didn't know that Black Americans were 4 times as likely as similarly situated white Americans to pay subprime rates, even when controlling for things like borrower income and property location. The impact on women and their families and communities became very clear to me when we traveled to Baltimore, my co-author and I, to one neighborhood in particular, that was the epicenter for predatory lending. As we drove past abandoned, boarded up houses, I noticed a cookout outside of a church. And so I jumped out of the car and started talking to the people. I wanted to interview someone, ask questions about how the neighborhood had changed. It was a neighborhood that had been particularly targeted by Wells Fargo. And two women agreed to give me an interview. It turned out that both of the women had lost their homes as a result of predatory mortgages and subsequent foreclosures. At the time I interviewed them, they were living in small, crowded apartments with their families. Now, both women worked hard, and one had graduated from college. She was doing graduate work. These women were the backbone of their communities. And when I asked them why they were giving away food at this barbecue, food they had purchased with their own money, they explained that their neighbors had even less than they had. So predatory lenders drain wealth from the individuals, the women who do the work to keep neighborhoods stable. And without neighborly help from women like the people I interviewed, neighborhoods crumbled, entire neighborhoods fell into ruin and still have not recovered. And then there's the impact of predatory lending on unmarried Black women. And I'll end by just saying the welfare queen trope helped to inspire a victim blaming narrative when Black women couldn't pay their predatory mortgages. They were described as greedy, they were described as ignorant borrowers. It really did relate very much to the welfare queen trope. Thanks.
Thank you, Cheryl. Kate, I want to stick with the theme of debt. And we know that debt disproportionately impacts women, and it takes many forms, including student debt. Could you speak to this a little bit?
Yeah, thank you. And thank you, Cap and Daniela and my fellow panelists. I won't sugarcoat it. Student debt is in crisis. It's a crisis in the US. And like so much else, as Cheryl outlined and Munira and Betsy, it disproportionately impacts women and people of color, and women of color especially. The fact is that achieving economic stability, let alone mobility, often requires a post-secondary degree. And the vast majority of jobs with wages that are high enough to lift women out of near poverty require higher education. So of the jobs where a woman's median weekly earnings are above 150% of the poverty level, 3/4 require some form of post-secondary education, and 2/3 require a bachelor's degree or higher. So given this, we, and I say we because I did too, turn to loans to cover the astronomical costs of higher education. So I'll throw out some more numbers just because I think they're really stark and can be helpful. In 2019, the average price tag for a public four-year institution was over $23,000 and almost $50,000 for private four-year institutions. So that's up from a little over $10,000 and a little over $24,000 respectively in 1985. The exponential hike in tuition costs absolutely outpaces a student's ability to pay for a higher education for jobs where they're required. And so student debt has ballooned. We know this. This has actually become much more a part of common conversation through the pandemic and sort of the forbearance that has been happening through parts of the pandemic that is frankly slated to end, and we'll get back to that, that is starting to raise these conversations. So there are 45 million Americans owe $1.7 trillion total in student loans. So in 2020, the average student loan amount is greater than $30,000. And these are broad stats that affect everybody. But of course, if you dig in, it gets worse. So between 2000 and 2018, student debt for white borrowers doubled. For Black borrowers, it quadrupled. Women hold 2/3 of all US student loan debt. And that's not even accounting for the fact that women enroll in higher education in greater numbers. It doesn't account for that disparity. Black women have the highest average student loan debt. And the burden of student loan debt follows borrowers long after graduation. And so this is a pretty stark comparison. I fully want to attribute this to our IWRS researchers, right? But 20 years after taking out student loans, the median Black borrower owes 95% of their debt, compared to the median white borrower who has paid off 94% of their debt. That's an economic justice issue and an economic crisis. It shouldn't require getting a higher education, trying to bring yourself and your family out of poverty shouldn't require tanking yourself economically, frankly, to be not so technical about it. But I can stop there because I think there is more.
That stat is my jaw literally dropped. On the subject of higher education, student parents who are overwhelmingly mothers face even more challenges in navigating school. And I know that you all have looked at this extensively. What are some of the biggest trends that you see impacting this specific group of women when it comes to costs?
Yeah, so this is also sort of surprises me, and I feel like it shouldn't, but more than 1 in 5 college students, so 22% of all undergrads, are parents. And it's in large part, I think we don't talk about it. This is not a population of students we discuss as a country very much, but for the roughly 4 million college students who are parents of children under 18, and as you said, overwhelmingly, 70% are mothers. And this is the way to a better life for them and for their children. And so student parents are often not overlooked on college campuses in the broader system of higher education. And so they lack necessary supports that would allow them to successfully graduate and even to mitigate in part student loan debt burden. So this is a subject, as you mentioned, of great expertise to IWPR, but I'll also say it's one very close to my heart. My mother was a single mother of 4 who earned her college degree when we were all in elementary school while she was waitressing and working other seasonal work. And so this is something that I obviously feel deeply and have experienced personally. And so in terms of this student parents and the debt crisis, unsurprisingly, that situation is even more stark. So student parents have family responsibilities, financial insecurity. There's also a certain amount there's higher enrollment in for-profit institutions that can lead them to borrow more for college than other students. And so the debt among student parents is more than 2.5 times higher than the debt among students without children. And so mothers, especially single mothers, borrow more than other student parents or students without children. And Black parents hold more student debt than parents or non-parents of any other racial or ethnic group. And I want to talk a little bit about why Black students with children carry the most student debt. And I'm going to walk through some of the issues raised actually in a piece done by Nicole Lynn Lewis. She's a friend of IWPR and founded Generation Hope. But so we have the racial wealth gap. And to kind of give another sort of horrible dichotomy of statistics, the average net worth of white families is 10 times greater than that of Black families. Knowing great numbers are helpful, but we're talking about $171,000 over versus $17,150. And that makes college prohibitively expensive for many Black parents. We're also dealing, as I mentioned, with student parents with more financial responsibilities. They have childcare costs, steeper rent, literally more groceries and medical expenses for themselves and their children. And then the financial aid process is really opaque and full of obstacles. There are childcare expenses that can be taken into account when determining financial aid awards, and dependent care allowance forms that can allow federal loans to be increased to cover childcare. But this information is hard to find and rarely publicized. Standing in line I stood in line as like a little kid, and my mom's like waiting in line with like 4 kids in tow at a student financial aid office. We're making it too hard. And the fact, right, that I can point to my mom and say, like, but she did it. That's not an example of like, and it works. It's an example of like, it's a miracle that happened. That's not an example of the system working, right? And I think that's really important to name when I give the example. And so, looking at, and I think we're going to get to policy solutions, so I won't go too deep, but looking at student debt cancellation, the impact the forbearance has had, and what potentially really devastating impacts it will have when all of this debt is due, is, this is an economic justice issue and a racial justice issue in a really profound way that is getting more discussion, but also needs accompanying policy solutions to really take root.
Great, Kate, thank you. I want to talk a little bit more about, you talked about care and policy solutions. So Betsy, I'd like to talk about care infrastructure. A recent CAP analysis found that women need approximately 17 million leaves a year, from health to caregiving leaves. 5.9 million of those leaves go untaken, and another 3.8 million are taken, but without pay. And the problem is severe among women of color. Among Black women alone, 6 in 10 leaves are not taken or are taken without pay. So you've written extensively on the need for a comprehensive federal paid leave policy. And I would love for you to speak to the cost of not having paid leave for women and their families. And, this is all against the backdrop of the fact that women's work is often undervalued, perhaps no more so than when it comes to caregiving, both for those women taking care of their own families as well as those who provide the care. So could you also talk about why investments in childcare as well as elder care are so critical to women's economic security and the economy?
Absolutely. So, I'm glad you threw elder care in at the end, because I was going to say, most of us are caregivers for most of our lives, either to children or to older adults, to somebody who needs our help. How much of our help they need waxes and wanes over our lifetime. Unfortunately, when it waxes, some people are forced out of the labor market, and we don't have a labor market that's very forgiving, that allows people to enter and exit easily. And if you combine that with your own health issues, there's a lot of obstacles that people face to continuous employment. One of the things that we know about labor force participation is that when people face something that forces them to exit the labor force, it's hard to get them to come back in. They don't come back in easily. It's much better to keep people attached to the labor force, for them to be able to continue on in their jobs as they manage through a life crisis. So from a societal perspective, a system that allows us to take a paid leave will help people stay attached to their jobs, which will help make us more productive as a nation, because we will keep people in the jobs in which they are productive. It will keep us with a higher labor force participation. So what about the individuals? Well, the problem is that you often either are just unable to take leave. So you're faced with this very difficult choice of, quit or not be there for the people who need you. And that's a really painful, difficult decision emotionally. And if it involves quitting, is a very difficult situation financially. And then there are people who are able to take leave, but it's unpaid. And then what you're doing is combining the stress of whatever life event is causing you to need to take time out of work with the stress of having to fund that period of outside of work. I think it's important for people to realize that with a national paid, federal medical and family leave system, we're all paying into it. It's not that we're asking people handouts from somebody else. We're saying, let's all pay in so that we don't have to have additional stress at our times in life that are of highest stress. So we don't get thrown into complete crisis from which we might not be able to recover when we have a medical issue with ourselves or with someone we care about, but that we're able to have the safety net that gives us a level, a minimum level of, living standards and ability a safety net is not just about catching you so you don't fall down, but it's about bouncing you back up. And I think it's just long past time that America had that kind of safety net. And if you want to see how well it works, we did the best we could at creating a very strong safety net during the pandemic. And we had the fastest economic recovery we've ever had as a result. So a safety net's not just about what I need, or, I totally agree with you that it's low income women, particularly women of color. These are real hardships that cause pain and suffering. But we don't even have to say, let's just do it for women. Let's just do it for the economy so that we can be a modern 21st century nation.
Excellent. Before we move into the Q&A, I wanted to make sure to loop back to give each of you a chance to reinforce, what you see as the most critical reforms policymakers should be focused on. So obviously, paid leave is one of them. But Munira, I'll start with you. If you could give your answer there.
Yeah, I'll try to be really quick. At baseline, we need to get all women insured with adequate, affordable, comprehensive coverage. There's no doubt the ACA took huge steps in getting more individuals and families covered, but millions of people remain uninsured in this country. The Biden administration, however, has taken steps to reach more families with affordable health coverage. Through the American Rescue Plan, the administration has extended marketplace subsidies to more families whose incomes were too high to qualify for subsidies before, but this change is temporary. The Build Back Better Act has made additional proposals to get more people affordable coverage. If passed, it would close the Medicaid coverage gap. So that means people who live in states that haven't expanded Medicaid and whose incomes are too low to qualify for subsidized care through the marketplaces would be allowed to purchase insurance through the marketplaces at little to no cost. And specifically to women, the Build Back Better Act would proposes to extend Medicaid coverage to 12 months postpartum as opposed to just 60 days postpartum. And as others have mentioned, includes paid family leave. So proposals are on the table, reforms can be made. It's just up to our federal government to really push these forward.
Great, thank you. Cheryl?
Yeah, I would like to see more activists buy shares in public companies. As corporate shareholders, activists can advocate for corporate governance policy changes by using the processes for corporate governance. And these processes provide a way for shareholders to communicate with corporate managers. So in the predatory lending context, shareholders could have asked boards and the officers of these financial institutions that use predatory practices, they could have asked the board to take corrective action. And that corrective action would be to monitor compliance with the law that prohibits discrimination. What I would suggest as a matter of policy in the private sector would be for shareholders to find a way to communicate with boards by using the shareholder proposal process, or they can communicate with boards and managers through demand letters. Shareholders are required to send demand letters to boards when a board breaches its fiduciary duty to monitor compliance with law. And that is certainly the case in the predatory lending context. Boards breached the fiduciary duty of loyalty to ensure compliance, or to at least monitor compliance with anti-discrimination law. And so that would be a good policy change impacting the private sector. But in my research, I found that changes in the cultures of large public companies have impacted the nation beyond the corporations. So I see a change in corporate culture as being a change that would benefit the entire nation. Thanks.
Great, thank you. Kate?
Yeah, so thank you. So I think started this, I part of this I have raised, which is right, this idea, research on student debt sort of cancellation, right? So there's like student loan forgiveness programs. I'm not going to get into all of that, but I do want to say that the idea of canceling debt, and there's research around between 50,000, 75,000, for those with household incomes below 100,000, 150,000, would yield incredibly good results for communities overburdened by student loan debt. It could knock out roughly half of all outstanding student loan debt and lead to substantial wealth gains, especially for Black households who then are no longer paying the exorbitant loan, but also obviously, right, the interest that accompanies these long-term large loans. That's one piece. The other piece being obviously supporting student parents. There are some programs that exist. There could be more programs, but there's also a great deal of clarity and support. There are nonprofits that are trying to help student parents, but this is also that's a policy solution. We can be doing better. And then, of course, there's just a longer term conversation that needs to happen about the exorbitantly high rates of higher education. The fact that Pell Grants can't possibly keep up with tuition inflation, and that we have a larger higher education cost problem that's going to need a real hard conversation about how we handle higher education financing.
Great, thank you. And Betsy, I'm going to ask for your opinion there as well, but I'm also going to direct the first audience question to you. And this person asks if the panelists can comment on the snowball effect that all of these pay issues that women encounter leads to greater poverty rates for older women, and how that is also complicated by women living longer, post age 65 than men.
Oh, that's a great question, although somewhat complicated. And I'll fit it a little bit into my answer, which is I think one of the greatest policy needs is for us to invest more in children. And that includes through early childhood education. And when I say early childhood education, I think of that as childcare as well. Like we all learned that K through 12 schooling is childcare. Care for our kids under the age of 5 should be curriculum based and should be age and developmentally appropriate to develop skills in our kids. And that's what's going to help increase equality by making equal investments in young children. It is absolutely the case that women end up more in poverty than men in older age. But it is also the case that we recognize the problem of elder poverty 80, 90 years ago when we passed Social Security, and we said we were too rich of a nation to leave our oldest citizens in poverty. And so I just highlight that 90 years later we're an even richer nation, and now we still leave our children in poverty, which I very much struggle with. If we look at what happens over women's lifetimes, it is the case that it's death by 1,000 cuts. Pew just came out with a study today that showed that, if you look at the wage gap between women under the age of 30, women and men under the age of 30, women are earning 93 cents on the dollar. In some cities, including Washington, D.C., women are, out earning men slightly, or there's no wage gap at all under the age of 30. And I think that people read too much into that. Unfortunately, I don't see that as, don't worry, the problem's solved, we're going to grow into it. It's that you haven't had a lot of opportunities for those promotions, or the inequality that exists before the age of 30 is inequality in the choice of occupations and industry, which is baked into, is somewhat driven by discrimination and differential investment at young ages. But when they do a study like Pew did, they're going to hold industry and occupation constant. So let's ignore all that stuff. Oh, look, the men and women are earning the same despite, enormous occupational segregation. But even with that occupational segregation, what's going to happen is at some point, maybe you're just a little bit delayed in getting that promotion, but that lasts your whole life. If you're 1 year delayed, that's a whole lifetime of raises where you're 1 year behind. And so what we see is the way the wage gap just widens as women age. It's been doing that for a long time. And it's because it's a death by 1,000 cuts. You get passed up for this promotion. You don't quite get hired for that job. You have to take a year off due to childcare issues or elder care issues. And all of those things accumulate. And then as the questioner asked, you get to old age, you get to retirement, and we've got women who are less prepared and they're going to live longer. The fact that they're going to live longer means that they're going to get Social Security is a better deal for women. So we've got that going for us. but they're coming into retirement even less prepared because they are going to live longer.
Great. I don't know if anyone else wanted to jump in on that as well.
I just want to just say quickly with respect to older women, since I am one. I'm an older woman caring for a super senior, my 97-year-old mother. And she was one of the first Black women to graduate from Hunter College here in New York City with a degree in biology. She worked hard all of her life in the home, outside of the home. And I'm just watching as her resources are draining away, a woman who made all the right decisions. And then just very quickly, I interviewed several women about the wage gap. And I just don't want us to ignore the emotional toll that women who face racism and sexism, the emotional toll and the economic cost, because I've seen many women leave the labor force because of this emotional harm. Thanks.
Oh, Jenny, can I jump in with actually one policy solution to Cheryl's point that's really important, is we do need to change Social Security so that we are giving more to people who are with the lowest incomes, but also to people who live the longest. You know, you're out of assets at 90. So, you know, God bless Cheryl's mom, who's still around at 97. I'm sure you're thrilled to have her around, but we need more insurance against that joyous outcome, because none of us can really be prepared to live to be 110, and some of us will.
Excellent point. Kate, were you trying to get in as well?
I wanted to raise one other piece that Cheryl raised for me, and it came up in a conversation with a lot of women leaders led by Black women leaders. But in terms of the emotional toll of the discrimination for women, I want to name what we all saw with the nomination of Judge Ketanji Brown Jackson's confirmation hearing. We all got to see, in really stark terms, what an interview process for Black women looks like. And that's what they were willing to do in public. And so there is really, I mean, I raised this right in the last minute, but I thank you, Cheryl, for raising it, because there are financial costs to right? That's an interview, technically, an interview process that is that openly hostile. And then there are financial costs, because how can someone not want to say, like, forget it, like, who wants to work in this environment? Thank goodness she's not saying that, but I'm just right. But like, it is, it was a real moment of reckoning, and I expect a real triggering moment of trauma. And I just want to name that here, because I think what I would like to see, and I think what IDPR is really interested in, is sort of like, how do we look at that, right? This calculation of emotional and financial costs for women of color going through interview processes and job environments like that, because that's what they were willing to do in public.
Now, that is a really excellent point, and I know we could talk for another 5 hours about all of this, but we are at time. I just want to thank our fabulous panelists. This is a great way to round out Women's History Month with some very accomplished women, just giving us some really great insights on the work that's been done, but the work that still remains. I want to thank our audience for joining us. You could always check us out on our website, americanprogress.org, for more information. Everybody take care. Thank you.